Hi, this is Dr. Stephen Bracci, Verve Medical Cosmetics. There's a wide variety of approaches and costs associated with treating under eye bags and dark circles using fillers. The diversity in pricing is due to several main factors, and this includes whether one opts for just an individual filler or a more comprehensive treatment plan to treat the whole area, and of course, the type of fillers used or fillers used in this area, and of course, the provider's level of experience and expertise. Prices for a single filler may start at $1,000 or even less, but opting for multiple fillers on each side across several visits, as the EyeRise procedure does, can elevate the cost to several thousands of dollars. Well, of course, in my opinion, this can yield the best results and most satisfying, aesthetically appearing results. Over the last 20 years, my experience is treating under eye bags, and I'm recognized as a leading expert in this field. Filler treatments in this area is the most challenging. Applying fillers under the eyes are the most difficult of the whole face to treat, but in my experience, patients feel that this is the most rewarding results that they get in this area. And it requires an extensive experience, ideally a history of successful treatments, ideally through looking at a large portfolio and gallery of before and after photos. And the main points are the areas treated. The key is to get a harmonious treatment in both the tear trough and the midface. That's the key part, is both of those areas. And you really have to understand the anatomy. The changes in the under eye area are characteristic with time and age. There's two main anatomical considerations. First, there's this orbital rim. It's a bony circle around the eye. And this gets larger due to loss of bone with time and age. Also, there's a main support system in the midface that's related to muscle and fat, and of course the main support is bone, so you want to replicate that mid-face support system as well. And the importance is of treating both the tear trough and this mid-face comprehensively and collectively. So let's talk about the filler type application. And there's a limitation of using only one type of filler. The main filler that most people use is this hyaluronic acid fillers, and they are most commonly used. And brand names you may know are Juvederm, Restylane, Versa, RH. However, there's a limitation in using this type of filler in the area as it attracts water, and using more than a little bit of it often leads to puffiness. The under eye area is particularly notarized for being puffy and holding too much water in this area. It's like putting an extra layer of fat in this area and just makes you look bloated in this area. It doesn't match the rest of the face. The challenges and risk of treating the area separately. All too commonly, people are putting hyaluronic acids in the tear trough alone, and it doesn't really match the mid-face and can look puffy in that area. Another approach is just treating the mid-face alone without the tear trough, and this just makes the mid-face look puffy, and it makes often the tear trough crease look deeper. So you can worsen the tear trough and make the mid-face look deeper by just treating that area. And the worst of all is what I see is treating both, using hyaluronic acid for both the tear trough and the mid-face. That just gets the whole area puffy. So there's really limitations of using hyaluronic acid in this area. The benefits of a multi-filler approach over several treatments. Basically, that's really where the results come in. The EyeRise procedure uses a specialized hyaluronic acid filler in the tear trough called Bolotero, and while matching the mid-face with more of a bony support such as radius to give harmony in both this area. So you have a small amount of hyaluronic acid in the tear trough while benefiting from the more firm lifting and support from radius and the mid-face. So also another consideration is using needles versus cannulas. So cannulas are blunt and they're more precise, and they cause less bruising in this area, and they're particularly beneficial in this area. That's how I developed the EyeRise technique when cannulas came out in the early 2000s. Where the more commonly used needle in this area is less precise and more likely to cause bruising. So it takes a level of expertise to use a cannula, but in my opinion, that's really where the results lead. So why choose the EyeRise procedure? The EyeRise procedure is a comprehensive treatment that has the advantage of using different fillers for different layers, different anatomical parts, and uses enough fillers, I fill to completion. And that, as I mentioned, several fillers are used per side. This is a procedure-based approach, and what it comes down to is a harmony and getting the whole area fully corrected so you're satisfied. And I do that over several visits, and I show before and after pictures, and I treat to results. And that's where the beauty and the science lies, in really reaching a full correction where people are satisfied.